Taoiseach, you said something earlier that I agree thoroughly with, which is if COVID is widespread in the community, the consequences are felt in the hospitals, and we're seeing them in hospitals around the country. In that context, we should, in my opinion, be worried about the fact that the reduction in the number of cases has now somewhat stalled, it looks like, in a very worrying way. And while everybody supports as an objective the idea of keeping schools open, there are significant concerns about whether the contact tracing of positive cases in schools is adequate to really establish whether schools are acting as a vector for transmission of the virus. I mean, let's put it very simply, Taoiseach. When we closed down the schools during the last period of restrictions, we got community transmission down to almost zero. We've left them open this time, and now the efforts to reduce community transmission are stalling. Now, I'm not saying the two things are necessarily connected, but we need to know. And teachers and parents are expressing concerns that children or teachers who would themselves see themselves as close contacts of confirmed cases are not actually being contacted by public health teams, are not being deemed because of the narrow definition of close contacts that's being operated, which, by the way, is out of sync with the ECDC close contact protocols. Doesn't this need to be looked at?
First of all, I think Deputy Boyd Barrett, I'm disappointed with the presentation he made, just positing the sort of coincidence between the return of schools and the rise in cases. And he's been a long-term advocate of looking at these issues from an informed perspective. We've done our research, NEFID has done its research, the HSE has. The level of cases after very considerable testing in schools, post-primary 2%, primary 2.5%. No, it's not narrow definition at all. And equally then in terms of international research in Denmark, in terms of France and others, there is no evidence that schools act as a vector for the transmission of the disease. The evidence is not strong in that regard. I think it's been a good thing for our children that we've opened our schools. And I think we should all support that, in my view, unequivocally. Why? Because I think children out of school, it will damage them in the long term. And particularly children from disadvantaged backgrounds will be damaged long term, and they'll become a long-term victim of COVID-19. We have to do it safely, and we have to do it with strong protocols and a strong approach in relation to it. But a lot of work has been undertaken in relation to that. I've spoken to school principals. I spoke to one last week who volunteered to me that since the Halloween, he's found a very big improvement, and he's found his interaction with the HSE very constructive and positive. And he said that without I having to ask him. And he was appreciative of the resources that had been allocated in terms of the minor capital grants that post-primary schools got for the first time ever this year. They got the second tranche of that this year for next year, and that money has been allocated to them to prepare early for 2021. It's very significant funding that post-primary schools would not have received in the past to enable them, to help them get through COVID-19. And primaries obviously have received a minor capital grant, but we expanded it this year. You know, it has had, in my view, a beneficial impact on families and on children. So we must do everything we possibly can to keep the incidence of the virus down.